everyone for joining us for our first webinar of 2025. I really appreciate you giving us your evening. I'm going to go ahead and introduce our speaker tonight. We have a really interesting topic from Dr. Bob Feder titled Greenspace and Mental Health, What is the Evidence? So before we get into the presentation, I'm going to start us off with a land acknowledgement. So this webinar takes place on Ndakina, which translates to our homelands that is now called New Hampshire and Vermont. Ndakina is the unceded traditional ancestral homelands and waterways of the Pennacook, Abenaki, and Wabanaki peoples, past and present. We acknowledge and honor with gratitude the land, water, air, flora, and fauna, and the human beings who have stewarded Ndakina throughout the generations for over 12,000 years. So I now have the pleasure of introducing our speaker for tonight, Dr. Bob Feder. Bob chairs New Hampshire Healthy Climate's Behavioral Health Working Group, and we're lucky to have him serving on our board of directors as well. He is recently retired from a 40-year career as a psychiatrist in New Hampshire. He majored in psychology at the University of Michigan, then went to medical school at the University of Washington and completed his psychiatric residency at Yale. He is active in a number of climate groups, including the Climate Psychiatry Alliance, 350 New Hampshire, and No Coal, No Gas. He is also the American Psychiatric Association representative to the steering group for the Medical Society Consortium on Climate and Health, which is New Hampshire Healthy Climate's national affiliate. In addition to working for greener energy, Bob enjoys singing, playing guitar, hiking, skiing, and boogie boarding, and he'll be giving us an hour of his time tonight. So before I hand it over to him, just a few housekeeping things. Feel free to put questions in the chat throughout the presentation. And then at the end of Bob's presentation, we'll have a Q&A session where I can either read your question from the chat or call on you to unmute and ask them yourself. So with that said, I will hand it over to you, Bob, and I'll share your slides right now. All right, let me know if you're seeing that.
Yeah, looks good to me.
Great.
Okay, well, thanks very much for that introduction, Emily. We're going to talk today about Greenspace and its effect primarily on mental health, but also touch a little bit on its impact on physical health in general. Okay, next slide. So most of us have sort of a sense or a belief that spending time in this kind of an environment is going to be better for you than spending time in the environment on the next picture. But what's the real, whoops, what's the real evidence for this? I mean, as I say, most of us think that being out in nature and next to green things is good for both our physical and mental health. Compared to being in non-green areas that are filled with concrete and buildings or just dirt and sand. But is there any really good evidence for this idea? Okay, next slide. So when you're going to look at this in a scientific way, first you have to realize that there's many different ways of measuring green space, and these studies have not all done it in the same way, which is part of the problem in evaluating them. One way of measuring green space is simply measuring how close people live to a green space area. But then you have to define a green space area. Is a green space area an open field with grass, or does it have to have trees, or does it have to have bushes of a certain height? Then the size of the green space area becomes an issue. You know, how big of an area of green space are you going to be looking at, and how is that related to possible health outcomes? Another thing that can be considered is the density of the tree canopy that's involved. You know, is it mostly overlying trees that make it important, or can it be anything that's green? Another factor that studies look at is how do people utilize the green space? Do they simply live near it or next to it, or do they actually go out into it many times a day and you know, experience it? That's another factor. So these were all, very poorly controlled variables in a lot of the early studies on green space. And an attempt was made to try and objectify this in some way so that everybody was talking about the same thing. And one of the most widely used ways of doing this is something called the Normalized Difference Vegetation Index. And the way this is done is satellite images are taken of the area that you're looking at or that you're studying. And numbers are calculated by looking at the amount of absorption and reflection of certain wavelengths of light to actually determine the amount of green stuff in that area. And this doesn't really differentiate between grass and trees or bushes and leaves that have fallen off of trees. It's just a general measure of how much green stuff is around. Um, Another measure that's very similar to this is called the Enhanced Vegetation Index. This is considered by some people to be a little bit more accurate. It does some fancy things with the different wavelengths that are involved to come up with what some people feel is a better measure of the amount of green things in the area. Another measure is the vegetation continuous field, which really gives much more weight to tree canopy and looking at actual tree canopy overlying an area. And then the most recent objective measure that people have come up with in this regard is something called the nature score or the nature quant. And this takes into account the amount of actual vegetation that can be seen, but also how much of this vegetation is actually available as parkland that people can use, for recreation or to actually be with. There's also measures of air, noise, and light pollution that go into this nature score as well. So these are all different ways that people have looked at green space, and they're not all consistent across studies, which makes for some difference in interpreting the results. But more recent studies have tended to rely mostly on this normalized difference vegetation index as a way of trying to get some consistency across the studies. Okay, next slide. So first, we're going to just look at very briefly the state of the evidence on green space and general physical health. Now, there's been literally thousands of studies done looking at this, and most of them were pretty bad. They weren't very well controlled, hard to make a lot of sense out of their conclusions. But this was a massive meta-analysis that came out this year of all of the studies that have been done looking at physical health and green space. It's basically a meta-analysis of meta-analyses. It reviewed all other meta-analyses that had been done prior to 2024 that have looked at the effect of green space on health. And it looked at 154 different separate independent meta-analyses, each of which reviewed around 100 studies. And their conclusion in looking at all of this data was that there was tremendous variation in the design of these studies, the definitions that they used, and outcome measures, so that it was hard to make much out of a lot of this information. But they felt that they could conclude that there was moderate to high association between exposure to green space and certain outcome measures. And these were all-cause mortality, cardiovascular mortality, diabetes, preterm births, small for gestational birth, and an overall feeling of well-being. Most of these studies did not really look at mental health variables very closely, but they often, just asked people, well, how good do you feel? And that was their general feeling of well-being. So they felt that there was some consistent data in all these studies for these particular conditions. But the difference was a relatively small one. If you looked at people that were living in high green space areas or had very high exposure to green space, they had about a 10 to 15% difference in the incidence of these conditions compared to people that were living in low green space areas. So it was a small difference, but it was felt to be, statistically significant across the number of studies that found these differences. There were low to weak to virtually no associations at all for cancer, high blood pressure, pulmonary disorders, and dementia, which were the other, key conditions that were usually looked at in these studies. So that's pretty much a general description of the data as it exists right now for general physical health. There was another study that looked specifically at the cardiovascular issues because this big meta-analysis found there was a connection with cardiovascular disease. And this was another meta-analysis that was done a little bit earlier, looking specifically at cardiovascular disease and green space exposure. This meta-analysis reviewed over 6,700 different studies that were all done before 2021. And it chose, it could only pick out about 53 of all these studies that were felt to be high enough quality to even bother to review them. So, it gives you some idea of the quality of data in this field. But, looking at these high quality studies, these ended up covering about 18 different countries and over 100 million persons. So there was, a significant number of individuals in these studies to be able to draw some conclusions from. And what they found was that when you look at this NDVI index, the satellite measure of green space, that for each 10% increase in this measure that people spend most of their environment in, they have a 2.5% lower risk of all four of these things: overall cardiovascular mortality, ischemic heart disease mortality, stroke mortality, and stroke incidence. So again, it's a relatively small effect, but it's a definitely statistically significant one that holds up across a number of these different studies in different countries. Okay, next slide. In terms of the general health outcomes for children and adolescents, this was another meta-analysis that looked basically, at this younger age group. Again, they had to trash most of the studies that were done. They looked at over 9,000 studies, and they felt that only 140 of these were of sufficient quality to be worth reviewing. And even, for these high quality studies, they had a great deal of inconsistency, both in terms of their outcomes and the way they measured things. But they were able to state that there were fairly consistent relationships across these studies for obesity and mental health. That, the kids that grew up in high green space areas had 10% lower incidence of obesity and mental health issues compared to kids growing up in low green space areas. Again, a small effect, but a definitely significant one in terms of the statistics. All the other health measures that were looked at for kids, cardiovascular, respiratory, gastrointestinal, neurologic, they could find no real relationships between green space and these factors. Okay, so that brings us to the issue of mental health. We sort of think that maybe green space might have a bigger effect on mental health than physical health. The previous physical health studies that I just went over, had some findings that implied that this could be the case. So let's look at the studies that specifically looked at mental health effects of green space. Now, when you do that, in addition to, having all the different ways of measuring green space, there can be very different ways of measuring mental health. And these include simply asking people to self-rate their own mental health. The investigators in the studies can actually rate people on mental health, and that can be done using a variety of different methods that are not consistent across lots of different studies. Another way of doing this is simply looking at people's medical records and looking at diagnoses and rating of mental health in their medical records. Another way that this has been done in a number of studies was simply looking at the number of mental health related medical visits that people have over different periods of time. And then finally, when you're looking at the data for children, some studies used parents or teachers' rating of the kids' mental health. So all these different ways of doing it, again, result in lots of studies that are hard to compare to each other. Okay, next slide. So again, there have been a couple of meta-analyses done relatively recently looking at all of the data that exists and trying to come to some reasonable conclusion or understanding about this. This was a study that came out in 2022, a meta-analysis that looked at 40 studies that were published between 1980 and 2020 that looked specifically at the effect of green space exposure on different mental health disorders. And what they found was that in these studies, there was great variation in how green space was measured and how mental health was measured, which made it difficult to, compare these studies to each other. And however, the majority of studies did find statistically significant relationships between the amount of green space exposure, and they found this in both resulting in lower incidence of mental disorders and less severe symptoms of mental disorders in people that were exposed to greater amounts of green space. And this seemed to hold especially true across these studies for ADHD in children and depression in adults. These were the two mental conditions that consistently seemed to show a relationship to green space exposure, where children that had more exposure to green space had less in the way of ADHD incidents and symptoms, and similarly for adults when you look at depression. And interestingly, these effects seem to be independent of the urban environment. I mean, one way of looking at this is saying, you could say that, well, people that aren't exposed to much green space are probably in urban areas, and the urban environment itself can cause lots of mental health problems. The issue isn't, how much green you're exposed to. But looking across these studies, the studies that were done just in urban areas found the same thing that studies that were done in suburban or rural areas. Regardless of where you do the study, the more exposure people have to green space, the less problems they had with mental health issues. This was another meta-analysis that came out this year, done by a different group of people looking at the studies. They pulled out what they thought were 59 high-quality studies from this 10-year period of 2013 to 2023. And all of these studies, again, use this objective measure of green space, the NDVI, so that you could at least say they were looking at the same thing on the green space side. And they all also used clinician diagnoses of mental disorders in the subjects, which again is probably the best way to go about doing this, to make sure that you're really measuring mental health correctly. So these were all studies that were done well. And they actually found more consistent results than the previous meta-analysis. When you control for how you're defining green space and how you're measuring mental disorders, they found significant relationships between green space exposure and a number of different conditions, including depression, anxiety, dementia, schizophrenia, and ADHD. All of these conditions showed a relationship where the greater the exposure to green space, the lower the incidence and severity of these conditions turned out to be. Again, it was a relatively mild effect. There was only about a 5 to 15% difference in the different studies comparing high green space to low green space people, but again, it held up and it was felt to be statistically significant. Now, there's been a number of studies in the last few years looking at green space exposure and green space exposure and mental health in specific population groups and in specific settings. And there's been pretty good studies done that show a consistent relationship where the more green space, the less mental health distress in all of these different situations. People living in urban, suburban, or rural areas, regardless which type of area you look in, you can see this relationship. It's not simply a matter of urban versus rural. In elderly people, this relationship has been found. In young children. It's been found in adolescents. It's been shown consistently. Also, for people living alone, very lonely people seem to do better with more green space exposure. There were several studies done during the COVID pandemic, and when people were, really isolating from each other, it was found that people that had more exposure to green space during that period of time tended to have better mental health outcomes. Cancer survivors tend to do better when they have more green space exposure in terms of their mental health. And also, if you look solely at economically disadvantaged people, people that are really having a rough time, again, if they get more green space exposure, their mental health outcomes tend to do a little better. And now I wanted to look at a few specific studies that are quite interesting. These were all studies that were done very well. I mean, these are kind of examples of how to do a study like this if you're going to do one. And I wanted to look at all of these a little bit more closely. This was a study done in 2019 in Denmark. And Denmark is a very fascinating country when you're looking at any kind of illness because Denmark keeps track of all health statistics for every citizen in the country from birth till death. They have something called the Folkeregister, and they track health data very closely in Denmark for everybody in the country, so that there have been a number of epidemiologic studies that have been done there that can only be done there because they do such a good job of keeping track of all this data, throughout the life of every person in the country. So this particular study followed every person born in Denmark between 1985 and 2003. It says for whom longitudinal mental health outcomes were available, and that was most of the people that were born in that period. It was almost 1 million people that they were tracking. And they measured this NDVI, this satellite green space image, for everyone in this study every year from birth to 10 years of age. I mean, just an amazing amount of data that they accumulated. They figured out where these people were living, and they measured this NDVI number for a certain radius away from their house. I don't remember what it was. It was something like either 100 yards or 300 yards, so that they got this Greenspace index for where these people were living and growing up. And they followed these people for a number of years, so that by the end of the study, the people were ranging in age from 16 to 34. And they looked at you know, the mental illness histories for all of these people. They had this registered in the Folka register for everyone that had a psychiatric diagnosis. And what they found was that the likelihood of developing a mental illness later in life was linearly related to the green space exposure that these people had in childhood. And those that had the lowest exposure to green space in childhood had a 55% higher incidence of mental illness compared to those with the highest green space exposure in childhood. And they, tried to sort out a number of possibly complicating factors here. Again, whether people were living in cities or out in the country, whether they were rich or poor, whether their parents had a history of mental illness or not. And they found that the results of Greenspace were independent of all of these factors. You could, factor out all of these issues by statistical means, and the Greenspace still was having a significant impact on mental health outcomes in Denmark. Okay, next slide. This was another Scandinavian study done in Finland. And this study came out a couple years ago. They followed 24,000 adult Finns from 1988 until around the time the study was published, and they measured green space exposure again by this satellite method uh, every year for 14 years. Within a certain radius of where all these people were living. And then they looked at their medical records and they logged all incidents of depression. They only looked at depression in this study. And they found that at both the 5-year mark and the 14-year mark, those that had the highest, in the highest half of green space exposure, had half the incidence of physician-diagnosed depression as those in the lowest half of green space exposure. So, in both of these studies where they did things very, very carefully, they found a much greater effect size than they had in these other meta-analyses that I had talked about earlier. Here, you can have up to a 50% impact on the incidence of depression in this study and other mental illnesses in the other study, which is really quite impressive. Okay, next slide. This was a study that came out last year in Wales. Again, a massive study where they looked at over 2 million Welsh people and followed them for 10 years. This one used the Enhanced Vegetation Index, which is a version of that other index that most of the other studies use, but this is felt to be, an even better measure because of the different wavelengths of light that are used in it. And in this study, they looked specifically at anxiety and depression that required treatment. Again, going through the medical records of these almost 2.5 million people. And they found that those people that had the greatest access to green space, which they defined as living the shortest distance away from green space, had 80% the likelihood of developing anxiety or depression compared to those that lived the farthest away from green space. And they actually, again, found a fairly linear relationship here that for every 360 meters further out from where you had access to green space that you lived, your incidence of developing anxiety or depression went up by 5%. Okay, next slide. Um, This was a study that just came out this year, looking at almost 500,000 adults in the United Kingdom. They again were followed closely for 12 years. They used this NDVI index that most of the other studies we've talked about used. And they looked at new diagnosis of depression and anxiety. And they found that for the highest quartile of people with exposure to green space compared to the lowest quartile, those in the highest quartile had 84% the rate of depression and 86% the rate of anxiety. So this is kind of more similar to what most of those larger meta-analyses were finding, about a 15% difference in incidence when you're looking at high green space compared to low green space people. They wanted to find out what this was being mediated by in the air, and they looked also at levels of nitrous oxide, SO2, which is related to sulfuric acid, ozone, and PM 2.5. PM 2.5 are very, very tiny pieces of particulate matter. They're like the smallest level of air pollution, solid air pollution components that you can get, and they've been related to causing a number of physical and mental problems. It's usually PM 2.5s are primarily a result of combustion of fossil fuel sources. And they found that the green space effect that they came up with in this study was largely mediated by the rate of these small particulate particles in the air as opposed to these other air pollution components. This is another study from this year that came out of Texas, and this used the nature score index that I talked about earlier that takes into account access to park areas, noise and air pollution, in addition to green space exposure. Texas apparently keeps track of all outpatient public health data that goes through the Medicare and Medicaid systems. So they've got all this data amassed in some way that can actually be used for epidemiologic studies. And this study looked at 61 million outpatient encounters across over 1,000 different zip codes in Texas over a period of time. I think it was a 1 or 2 year period. And they compared the health measures they were looking at with this nature score in the different zip codes that were involved in the study. And they identified 370,000 mental health encounters. Now, this is one problem with this study because you would have expected with 61 million total outpatient encounters, there would have been way more than 370,000 mental health encounters. And either these weren't being identified correctly or, possibly they were being excluded from this database for confidentiality reasons. So there's a real problem with this particular study in terms of the number of mental health encounters that they identified. But, be that as it may, this is what the study came up with. They did find that in the zip codes with the high nature score indexes, there were half the number of mental health visits compared to the zip codes where there were low nature score indexes. And this held true across a number of different psychiatric diagnoses, including depression, bipolar disorder, and anxiety. And it did not seem to be associated with race or economic factors, so that this relationship held true, in different Black areas as well as different poor areas. If the area had, a high nature score index, the people did well regardless of their race or their economic situation. Um, this next study looks specifically at schizophrenia, which I found to be interesting because, of all the mental disorders, schizophrenia is one that's considered to be very biologically based, very genetically based, and it's a condition you would think might be less responsive to green space exposure. But that really wasn't the case in this study. This was actually a meta-analysis that looked at 12 different studies that looked at schizophrenia and green space within the last 5 years. And it was a large number of subjects, about 50,000 different subjects across a wide range of countries: Denmark, Taiwan, the United States, Canada, Germany, Netherlands, and Poland. So quite an international subject base here. And green space in these studies was measured by various different satellite methods. They didn't all use the same method, but they all used relatively objective ways of measuring the green space. And interestingly, the high green space areas had only 63% the incidence of schizophrenia compared to the low green space areas. And they broke this down a little further and looked at hospitalizations for schizophrenia, and they found that the schizophrenic patients in the high green space areas had lower hospitalization rates. They didn't have to go in the hospital as often, but when they did go in the hospital, they stayed as long as people in the low green space areas. So not really sure what's going on there, but kind of an interesting finding. This last study that we're going to look at is a study that looked specifically at children, which had an interesting finding. This again was a very recent study that was just published this year. They looked at 539 school children in Barcelona, and they were followed every year from ages 3 to 11, measuring the amount of green space both near their homes and near their schools. They used both of these satellite methods, the NDVI and the VCF, and they looked at a certain radius both from where the kids were living and where they went to school. And they administered an anxiety score or an anxiety scale to all of these kids. And they found that the more green space there was surrounding the school, the lower the anxiety scores were for these kids. But that didn't hold true for their homes, that the amount of green space surrounding their homes was not associated in any way with their anxiety scores. So I thought that was interesting, that it looked like green space was having some effect on anxiety that was being generated in school for these kids, but not at home. Okay, so there does appear to be something going on here. I think there is clearly a significant amount of data that indicate exposure to green space is good for your mental health. And we wonder why this would be or how this would work, and nobody really knows. I think the next, phase in this research is going to be to try and work out possible mechanisms by which this effect is occurring. Possibilities include inducing a relaxation response by being exposed to natural imagery as opposed to synthetic imagery like sidewalks and buildings, and that this might be acting by reducing stress hormone levels like catecholamines or corticosteroids. It's also possible that being exposed to natural environments like this can increase release of endogenous endorphins or cannabinoids, which could result in better mental health outcomes. Also possible that exposure of this sort could increase brain alpha rhythm, which is associated with a kind of a relaxed state of meditative like a mental state. So these are all possibilities. We don't really know how this is working, but these are things that may be worked out in the future. So so this is kind of a little concluding cartoon of what I think we can say at this point. And I've got some pictures to end with just of various green space environments that I'd like you to look at and just kind of see how you feel when you look at these things. And I think you may notice that these pictures can create a sense of relaxation or well-being compared to having to look at all this black and white verbiage that you've been looking at for the last 40 minutes.
I couldn't find anything called.
This last picture is my favorite one. I think it just kind of sums it all up very well. Okay, so that's the end of my formal talk. I'd be happy to take any comments or questions that people have.
Wonderful. Thank you so much, Bob, for that great presentation. That was really, really interesting, and a lot of great case studies that I'm sure we can discuss more. There are a few questions in the chat that we can spend the next 15 minutes or so going over. I will start with this first question regarding green space and psychiatric disorders. The question was, are these studies taking into account income and also proximity to other sources of pollution?
Yes, well, some of them have. The better ones have. As I mentioned, there were a few studies that specifically did look at income and several other social factors such as race and urban setting. And the studies that looked at it, that bothered to look at it to try and factor that out, all came to the conclusion that the green space effect occurs regardless of these other factors that clearly are having an effect on mental health as well. So that if you are able to factor these issues out statistically, you still show that green space has a positive effect for people, whether they're living in the city or living in the country, whether they're poor or whether they're rich, whether they're black or whether they're white.
Wonderful, thank you. Moving on to more comments in the chat here. There was a question on correlation with diabetes, and then a comment in response to that with a resource sent around. So thank you for sending that. Were there any other significant findings you found on correlation with diabetes in specific studies that you can think of? Or was it just the one mentioned that we should focus on?
Well, the study that the meta-analysis that came up with that conclusion that there was a connection with diabetes cites the specific studies that that found that and the strength of their data. So, I would refer you first to the meta-analysis, and that can then point out the specific studies that actually looked at diabetes. Not all of them looked at diabetes, and not all of them, found that correlation. But you really have to kind of dig into that meta-analysis to find out, the strength of that connection and which studies found it. And if you're interested, you can let Emily know or email me, and I can get you the reference for that. But I can't really give you a better answer than that off the top of my head.
Sure. Yep. Thanks, Bob. And just so everyone knows, I will be sharing resources from this presentation in a follow-up email tomorrow with the recording, and can send links in that as well if you have specific questions about sources. Another question in the chat here is, what are your thoughts on Greenspace and blue space? And they even suggested trying a search of green blue space, putting those words together.
Yeah, that's a really good question and an interesting one, because there is evidence that living near a lake or living near an ocean, living near any blue space of water, can have similar beneficial effects. The amount of research that's been done on that is very, very small compared to the Greenspace data. And I'm not that familiar with it, to be honest with you, but there definitely is a body of literature on blue space, and there are people that are actively involved in looking at that issue, particularly how it affects people that live on islands and people that live on the shores of lakes. And I think the preliminary evidence that there is a beneficial mental health effect, but it's very hard to demonstrate a beneficial physical health effect from that. But I think there needs to be a lot more data before we can really say anything definitive in that regard.
Sure, thank you. An interesting question in the chat here is, are there any findings on differences between exposure to synthetic and natural turf?
Interesting question. I don't know that there have been. That's a fascinating question, and one that I can't answer, but you've stimulated me to try and look into it, and I can get back to you on that. Because these satellite measures would not be able to distinguish natural from artificial turf very well. I don't know that those you'd be able to get the answer from that. I do know that there's a lot of problems with artificial turf in terms of health issues that athletes seem to not like it very much. It's much easier for them to get injured on artificial turf than it is on real turf. And apparently, the plastic that's used in artificial turf is constantly being eroded from the turf and put into the air. So it's a significant source of microplastic. And I also believe that there have been some reports of skin problems from people that slide onto this turf and get these kind of plastic grass burns from it. So there are problems with plastic turf just in and of itself. Whether it's as good for you as real turf in terms of its psychological effects, I don't know, but that's a really, really interesting question.
Sure, thank you. Something to keep in mind going forward. Another question in the chat here is, are psychiatrists recommending that their patients with schizophrenia spend more time in Greenspace?
I don't know. That's such a surprising finding, and I doubt that very many psychiatrists are even aware of this study. We're really working on raising awareness among the mental health community in general about climate change and environmental issues, and we're finding it's an uphill battle right now. So I don't know how many psychiatrists are even aware of this issue. I I think that generally people advise any patient of theirs to get outside as much as possible, eat a good diet, exercise. Those are all things that are thought to be, good for any health condition. So I imagine that people are encouraging that, but specifically for schizophrenia, I don't know. I'd be surprised if very many were, because intuitively it doesn't seem like it would make that big of a difference in this condition, but apparently it does, and hopefully people will start encouraging that.
Yeah, definitely. I mean, that is one of the main aspects of New Hampshire Healthy Climates mission is educating healthcare workers themselves on these climate and health information and facts that they don't already know about, and then increasing climate informed care. So maybe this specific fact is something we can work with going forward. One last comment in the chat here from Stephen Peterson, who said there's a study by a pain doctor in Texas showing that 2 hours a day of green space exposure decreased pain for a series of migraine headaches by half, and also the frequency of the headaches themselves. Excuse me. And he thought the green light may cause more endorphins to be released. Does this sound consistent with what you've seen, or do you know about that study?
I don't know about that study, but it's certainly consistent with all of the other data that I've been talking about today, that, green space exposure helps. Whether the particular wavelength of green light is involved in endorphin release, that I don't know. I'm not aware of, any further data that's been done on that. But it's interesting, that you bring up the pain study. One of the first studies that were looking at the issue of green space that kind of started this whole endeavor was way back in it was either the 60s or the 70s at MGH. They were looking on a surgical ward, comparing patients that had a window that looked out on the next building to patients that had a window that looked out onto a park. And the patients whose windows looked out onto the park required less pain medication than the ones who looked out at the building right next door. So that was one of the early studies in this field. Again, it's hard, it's one that's hard to draw any general conclusions from, but it kind of reminded me of that.
Very interesting. Another question here in the chat from Rowena, who said lack of green space is a challenge for space flight in remote extreme environments. Any thought about the utility of virtual reality or something of that nature as a substitute for actual green space?
Yeah, I think that virtual reality would certainly be helpful for people that are in space capsules for prolonged periods of time. I don't know if that's actually being used by NASA or other space programs, but it's a wonderful idea and one that I think probably would be helpful.
Definitely, yeah. That reminds me of the scene from the movie Interstellar. If any of you have ever seen that, Matthew McConaughey listens in his earpods to the sound of thunderstorms and rain. So I think that's kind of a similar idea to this one. That was it for comments and questions in the chat. I invite anyone who has them, who has not asked, to unmute now if you have a remaining question, or throw it in the chat really quick. If not, I'm not hearing anybody. I want to thank you so much again, Dr. Fetter, for this great presentation. Really, really interesting. And thank you all for joining us for the start of our 2025 webinar series. I will follow up with everyone tomorrow with a link to this recording, resources, and I can send you Bob's information in case you have any follow-up questions. And then I will post it on our website as well. So feel free to share widely. Thank you so much. All right. Thanks, Bob.
You're welcome. Stay green, everybody.
Good night.